it's up to our individual committee chairs, for example. I want to sit down with my ranking member to find out what their caucus priorities are when it comes to health policy. And then I want to get the input of all of my committee members, not just the Republicans in my or my Human Resource Committee. I need to get the understanding of what they all are interested in moving forward. And I always say, we talk a lot about Medicaid. We're not going backwards. So don't tell me you want to go back to the way it was, but bring me solutions on how we can continue to move forward. And if you want to have that open, honest dialogue, then that's the dialogue that we'll have. And I think all of our committees should run that way. It really starts with our small groups in the House that we label as committees and how we work together individually within those committees.
Okay. I guess, do you have any feeling on an issue maybe a bill that'll come up this in your committee that people have a lot of eyes on, that you've got your eye on?
Sure, we talk a lot about the cliff effect, which I think deals with poverty. So, people start to improve their lives and they start making a little bit more money, and all of a sudden they hit that cliff where all social service programs disappear for them. And how do we get people out of poverty if we end the program just at the point where they're starting to get ahead, because they'll slide backwards? So we continue to have that conversation, whether it's in regards to child care, food stamps, Medicaid. I think that'll always be on our forefront. We just need to find solutions for it, and working together is the only way we're going to do that. We have some other legislation that I think really will have bipartisan support, and that is a pill that reverses the RU46, which is the abortion pill that you take in 2 doses. And it's an informed consent bill that will basically say there is a pill out there, if you take it in between the 2 doses, reverses the abortion. And women should know that that's available to them. And that's just information out there. It just gives them what they need to make sure that the decision that they've made to take that RU46 and they want to continue to go through with it, but if they change their mind, the option is available. So that'll be a little controversial, but I really think it's just a consent bill. We also have another bill that we're working on called the Cure Bill. Ohio passed it. You can do a little research on that, but what it does is it incentivizes researchers and developers to find cures for disease like Alzheimer's, like breast cancer, like ovarian cancer. My gosh, if we can find cures for those diseases, we solve a whole lot of problems within our own state Medicaid and Medicare systems, because now we've got a cure and we're not focusing on treatment, which becomes expensive. And that's really an interesting bill, and I'd love to talk to you more about it.
Yeah,
but
sure.
So those are some of the things that I'm working on in Health and Human Services right now.